We are here at Champion Physical Therapy in Kingsport. Joining us this morning is Charles Peters. Charles, thanks so much for having daytime here.
Absolutely. We are a fan of you guys, and we appreciate you guys coming out today.
Well, we're a fan of you guys. Tell me a little bit about what you all do here at Champion Physical Therapy.
So one of our primary things we do is we like to improve patients or just people's overall well-being. So whether it's just walking, if people like to be out on trail walking, running, or recovering from an injury or surgery, we see what your deficit is and look to improve that.
And you mentioned trail running. It is beautiful outside lately. A lot of people are outside doing a lot of summer activities, and you probably are seeing some injuries, some people coming in with maybe some ankle injuries or something like that, right?
Yeah, especially with our landscape in the terrain, you'll see some ankle injuries if it's twisting, or just a general tendonitis that is a common issue, and especially this time of year. It's seasonal, so as with anything, it's very common right now to see lower foot and ankle injuries.
Right, and you guys have a lot of different treatments and remedies that can help people that are having some of those lower leg issues, right?
Yeah, so we usually will highlight, we use a lot of manual therapy and skilled therapeutic exercises, but today we'll talk a little bit about instrument-assisted soft tissue massage, as well as some KT tape or kinesio tape.
Yeah, and we actually have a model who is letting us shoot her, kind of get one of those treatments. Tell me a little bit about what you're going to be doing on Kelsey. Kelsey, come on over.
So what we'll be doing first here today, again, I'll be using the kinesio tape, which again, it's more of a tape that gives support to the area, so it still doesn't necessarily limit you like pure athletic tape, but it's going to allow you to give you some support. Also, it can help improve blood flow to the area as well.
Wonderful.
So what I'll highlight here is just for the Achilles right here. Sometimes people talk about having a tenderness right here on this spot, or even a little bit higher up. So here what we'll do with the method today is I'm just going to apply 2 strips of tape to give a little bit of support to that area. And I'm looking to give support right here to that little spot. And real common that people have that irritation right there.
Right. And so people that feel that irritation, they can come in here to you, kind of ask you what you think, and then this is one of the recommendations that you have for them, right?
Right, so based on the exam and how they present, you know, some people will benefit more from this than others. This is, again, just another tool that if we find will benefit them that we'll utilize. Now with this tape as well, you can leave this on for a full day. We tell people a lot of times that they can run in it, so that's actually, it's an activity tape. They can take a shower in it, leave it on.
Wow.
For there. And the biggest thing is that they know is that there's a little bit of support, but there's also going to be allowing them to continue to do all their activities as much as they can.
Right. It provides some flexibility, which is nice.
Right. So it's not like if you ever see somebody have like an ankle taping for basketball. This one is more, so she can still move completely through that, but this will, again, highlight that tender area.
And so after people have this on, you said that they can kind of leave it on, they can go about and do their normal activities. What do you hope that patients, when they come and get this done, what do you hope that they leave with?
Ultimately, we want them to be pain-free. So if it's just jogging or running or walking, is to restore that back to its healthy tissue level.
Right. And so thank you, Kelsey, so much. We're going to bring another model over, and you're going to be providing some sort of calf treatment, right?
Yes, so another common issue, if you'll see with walking, people talk about an issue, just generally like more here kind of on this part of the leg. They'll have, you can have a calf strain, so whether if it's playing flag football or softball, they might have like a little pop or something like that. So we would assess to see what it is. But if it's just generally a common calf strain, people right up in this area will have tenderness, real sore and stiff. So one of the treatment methods that we would utilize is going to be instrument-assisted soft tissue massage. So what I would do is I will scan the tissue itself. So what we'll do here, we'll use the device like such. I'm just going to apply a little bit of kind of a lotion or lubricant here.
Okay. And I think what you mentioned too, you know, you find this in people who play sports, but you can find it in any age, right?
Exactly. So it's not just your general athletic population. It can be anyone who has an issue at all, whether it be in that area. So you don't have to be someone who walks. It can just be if you're working in your garden and step wrong. You can have an issue there. So what we'll do here, I like to scan the tissue as well. So I'm looking to feel the quality. Sometimes you'll have a little knot that'll pop up in the muscles that are tender. This helps or basically kind of get that to run at the parallel and keep the fiber strong. So for them, sometimes they will have a little discomfort. This is just like a deep tissue massage as well. They'll be beneficial, so it may not feel the greatest immediately.
It's not a light massage.
But it depends on what we're finding. with the actual treatment. So some tissues will be better than others, some will be more painful. Usually healthy tissue, it does not feel much pain if you press on it, but something that's malaligned or stressed, you'll have more pain with touching or palpation. So.
And how long does a treatment like this usually last?
So something like this, I can run anywhere from 5 to 10 minutes with this, depending on if it's acute or chronic, and what I find as I'm treating. So.
And what's great too is people can stop in here if they have any questions, if they have maybe any concerns for an injury, if they're feeling any discomfort, they can stop in here and get some quick care with you guys and just ask any questions,
Absolutely,
right?
Absolutely. So we're highlighting just on the calf and the lower leg today, but we go anything from head to toe as what we'll treat. So if it's musculoskeletal, anything orthopedic, a lot, we see that commonly.
All right. Well, Charles, thank you so much for having Daytime here. We so appreciate you demonstrating some of the treatments, just some of the treatments that you all have here at Champion Physical Therapy.
The preceding portion of Daytime Tri-Cities was sponsored by